we're ready to start. So, yeah. Yeah. Oh, there's Cliff. Oh my gosh. Your partners are here. Yeah. Okay. Welcome. Welcome, everybody. Hello. We're ready to start. I'd like to welcome you all to this program. I'm Judy Sedgman. I'm the director of the Institute for Public Policy and Leadership. And on behalf of Dr. Guilford, who had a conflicting appointment this afternoon, I'd like to welcome you to our beautiful University of South Florida Sarasota Manatee campus. And thank you very much for being with us. I hope this will not be if it is your first visit, it will not be your last. And if you've visited many times, please keep coming back. It's a wonderful campus. This is your community university, and we're always very pleased and proud to have visitors come to our programs. This is the last in the current series of Institute for Public Policy and Leadership programs, and I want to express my gratitude to the University of South Florida Sarasota Manatee for the opportunity that I've had to be a part of this exceptionally important contribution to our community, and to also take a moment to wish all of you a beautiful holiday season, as this may be the last time that we see each other before the holidays. It is especially meaningful for us to have this particular program at this time. As a person who's been involved in the healthcare field for almost 30 years now, I have to say that it's been a rocky road for a number of years. And one of the issues that has bedeviled all of us in healthcare is a complete lack of clarity about what the important questions are. What should we be talking about? What matters? Where are we going? And why is there so much turmoil and agitation over something that should be obvious? We have so many people out in the public talking about, oh, we don't need to do anything about healthcare, we've got the best system in the world. And then we have statistics that come out and say, no, we don't. We pay more than any other country for less service, and we have too many uninsured, and we have an inefficient, creaky system, and healthcare is the only industry that hasn't adapted to the integrated services idea. So we have issues that are critically important, and we are so fortunate to have with us today the two men, I think, who have done the best service to the healthcare debate that has been done to date by writing this book, The New Health Age. When I read it, I was so excited because I said, at last, somebody has got it clear, straight, and you can read this and figure out what to be thinking about, what to talk to your congressman about, what to care about. So it's a great honor for us to launch this here today. They're both here. They've got a number of signed books, as you may have noticed, coming in that are available to you. I highly recommend this book. I can't tell you how important it's going to be in the national conversation. So I'd like to welcome tonight David Hull and Jonathan Fleece, the co-authors. David is an extremely famous futurist. He's the futurist in residence at Ringling College, but he's also an internationally renowned speaker, author of several previous books. The one that everyone talks about is The Shift Age. And Jonathan Fleece is an attorney, which we're very lucky that he's a local attorney. He's about to become an international figure in healthcare, so I don't know how much we'll see of him as this book starts to make its way into the public. Jonathan is a member of the Blaylock Walters law firm, and I have to say that I'm very grateful to them for sharing his time with us and also for providing us with a lovely reception following this program, which we'd love you to stay around and talk to the speakers. And there's my colleague, Linda DeMello, a fellow colleague at University of South Florida, Sarasota Manatee. She's taken a real leadership role in defining healthcare issues that the university is going to face in the coming decade. And she and I will be moderating an informal discussion with David and Jonathan. When we finish, the discussion will be open to you. All we ask, and I know it's a little crowded and it may be awkward, but we ask that you go to the microphone to ask questions when that time comes, because we're filming this for Manatee Educational Television, and we really need to have you at the microphone. And when you ask a question, please identify yourself and ask your question. And I'm going to say in advance, by no means in a pejorative way, please ask a question, don't make a speech, because we have a lot of people here and there may be many questions. So with that, let me start with you, David, and say, okay, you're a futurist. What does a futurist do? And what motivated you to go after this topic at this time?
Okay. Well, first of all, believe everything she said. So I define what I do as a futurist as being a catalyst to get people, the market, and the world to think about the future and then to facilitate a conversation about it. So that's it generally. The reason that I partnered with Jonathan to write this book is I've traveled all over this country speaking to lots of corporations, lots of CEOs, and I get asked this question, particularly since Lehman Brothers went down: are we going to remain a great nation? And I found myself answering that question in the following way: if we don't better educate our young, if we don't become a healthier country, and we don't completely rebuild the energy, transportation, and communications infrastructure of this country, it doesn't matter what else we do. So then I decided I'd write the book on education and join with Jonathan in writing this book because, and this is our joint viewpoint, the conversation around healthcare in this country today is driven by misinformation, fear, and manipulated by politicians. And any conversation that is driven by fear, misinformation, and politics is not an intelligent conversation. So we wanted to write the book that would at least provoke an intelligent conversation about the future of healthcare in this country. So,
all right.
Looks like we might need some more chairs.
Yeah, I was just watching people come in. There's another bench on the other side of the auditorium. So Linda.
Jonathan, I'm going to start with you and then ask David to jump in. I think part of the experience that so many have is that healthcare is personal, very personal. So let me quickly say, within the last week, I lost a friend to stage 4 lung cancer. I had a young friend at 38 diagnosed with breast cancer. I've spent 10 years working with the ALS community, Lou Gehrig's disease, and watching the impact of a single diagnosis transforming lives and wondering, that could happen to me. And so I ask you, what are the things that we need to know about healthcare as individuals? Why so many of these people are here today? So let's start with you taking the first crack at that and let David pick it up as well.
I think to really do a good job of answering that, you've got to divide it into two parts. How is healthcare today? And if one of those ailments were to impact any one of us in the room tomorrow, how is healthcare functioning today? But more importantly, what the book is about is how will the answer to that question change over the next 10, 20 years in the new health age? I think today, to describe healthcare, it's a lot of disconnected parts. There's not a lot of integration. Medical records are stored in cabinets. Sometimes to get records from one office across the street from another office, you literally have to pick up the record, carry it across the street. So it's a very inefficient system. And I think when you look at a lot of the technology and the research and development in healthcare, a lot of it is not moving down the strata of society either. That's a lot of what's happening today in healthcare. Tomorrow and in the new health age, the way we think about healthcare, the way we deliver healthcare, and the economics of healthcare, all of those dynamic flows that we've outlined and defined in the book are going to change. So an example under the thinking dynamic, In the 20th century model, the thinking around healthcare was exactly how you just described it, around sickness. We think of healthcare as a system that we go to when we're sick. And it's not that cancer will go away tomorrow, although there are a lot of medical miracles around the corner that we'll talk about today. But in the 21st century model of healthcare, under the thinking dynamic flow, we're going to start thinking about healthcare as where we go to prevent illness and disease and to stay and become well. So the whole way that we think about healthcare is going to move from thinking about it as a sick-oriented system that I only go to when I'm sick to it's a system that I'm going to interact with and that is going to help me prevent disease and stay well, to prolong life and to reduce the risk of a lot of those diseases, et cetera. So that's at least part of the changes of how things will move from today to tomorrow.
And David, for you?
Relative to the personalization of it, I think everybody in this room, to a greater degree, has more personal power than I had 10 years ago. I mean, if anybody, I got 2 of these app phones. If you got an app phone, it's the portal through which you look at the world, right? I'm going to make my decisions based on what I see here. And so the way to think about healthcare is that it's a little less, it's 17.2% of our GDP. And all of the changes that everybody in this room demands that have occurred in the 80% of the GDP, I get to make a decision based on searching and finding information. I get a decision based on having electronic connectivity. All of that stuff is now just going to come to healthcare. You know, if anybody in this room banks at a big bank, say Chase or Bank of America, and you go into your branch bank, hey, how you doing? What can I do for you today? And you just happen to be cross town, so you go into another branch of the same bank, and I go, we don't know you. Here's a clipboard. Fill out the information. Everybody in this room would get irate. What do you mean? I bank here. You should know me. But we willingly are given clipboards every time we go to a doctor's office, even if it's a doctor that's been referred by our personal doctor. So there's no connectivity. There's no accountability. And so the personal benefits that are about to happen to everybody in this room with healthcare reform and the future of healthcare is you're going to have personal power. You're going to be at the center of the system rather than a non-documented participant kind of trying to find their way through it.
And I can add to that concept of personalization. In the 20th century model, cancer was treated in a very regimented way. So out of the thousands of cancer patients with breast cancer, for instance, there was a regimented checklist that this is how we treat cancer. With the Genome Project that was finished several years ago, and now the mapping of the human genome and the DNA, medicine is becoming personalized on the clinical treatment side. So when you take cancer and some of the tragedies that you mentioned that have impacted you recently, literally what's going to start to happen, and is happening today, is based on our DNA, cancer treatments will be personalized. There are certain chromosomes that interact differently with other drugs that can increase survival rates of cancer, literally sometimes double the survival rates than it was even 5-10 years ago. So the whole concept of personalized medicine on top of what David described is absolutely going to be part of the new experience.
So David, in order for us to experience the benefits of the power that we have, there's going to have to be a huge shift in the national conversation because right now we have a kind of, I think, a disconnect between what the average person wishes were true and what the political system is saying is possible and likely and what's available or what we can afford. So talk about the dynamics of the changing that national conversation at the policy level.
Well, the way I look at it is historically, as a futurist, I'm a historian. And, you know, a lot of people think that the government is getting into healthcare. And that's just the opposite of the reality that's about to happen. Government is saying, we are going to have healthcare. Just like Dwight D. Eisenhower said, we're going to have an interstate highway system. And FDR said, we're going to have hydroelectricity. The government didn't make the money in the hydroelectricity. The government didn't make the money on the interstate highway. It was just the government saying, here's the line in the sand, and we're going to cross it. We think, and as you know from reading our book, we think that the future of healthcare is going to be driven by corporations in the United States who can no longer be globally competitive because they're, a client of mine is Boeing. They have a $2.3 billion line item called healthcare. How can they compete with Airbus? So it's one of those times where we are in the new health age, and it is just time to shift. What people don't realize is that, so we're modern man. We've been around for 150,000 years. 4,500 years ago was the first time there's any mention of medicine, and modern medicine's only 150 years old. So we are in a new health age. It's just a rapidly morphing, rapidly evolving field that is only going to accelerate. So it's within that. It's inevitable. It's not a policy conversation anymore. It's about implementation. Jonathan uses the phrase gold rush. It's like 1848 in San Francisco. By 2 years from now, the landscape's going to be entirely different, and it's going to move that quickly. So, I don't think the bill is going to I think the bill is going to be affirmed by the Supreme Court, but even if it gets repealed, it's already a done deal.
Yeah.
So Jonathan, let's talk about implementation. Based on the research you've done, how do you see this moving forward?
Well, to sort of piggyback on the discussion David was having, regardless, as he just mentioned, what happens with the Affordable Care Act, or PPACA as the acronym is known, 90% of what we talk about in our book is the reality for the 21st century new health age. What's happening in America, again, regardless of what the policymakers are saying for political reasons, corporate America is driving the change today. And David mentioned one of the key reasons behind that. In America, the average cost for healthcare insurance per employee is up to $12,000 a year. In America, per American spend $8,000 a year on average for healthcare. In the 70s, that was about $400 a year per American. So even adjusted for inflation, you can look at that rapid increase in expenditures. We're now in a global economic world that David talks a lot about in his book, The Shift Age. For American companies to compete on a new global marketplace, we can't afford to tack on $1,000 per automobile in America just to pay for health care for the workers that built that. So it's truly corporate America today that's driving it, and they're driving it towards a world of we want to prevent disease for our employees, we want to move towards wellness for our employees, we want to focus on lifestyle change, reduce stress, and really do the things that will help move America out of this era of sickness and towards prevention and wellness, and focus on the chronic disease that's costing us so much money.
So if that's their end game, what are they doing to move their employees and the organizations and insurance companies, and the government for that matter, in that direction?
Well, I like to explain this to always just sort of follow the dollars. And if there are any insurance people in the room, this is my honest opinion, so that you're probably actually going to like this statement. The blame game is over. This is not the insurance company's fault. This is not the government's fault. This is not Americans' fault. The blame game is over. We've got to follow the dollars. And ultimately, the dollars are all of us in the room. Taxpayers, employees, we are ultimately the ones that are paying the cost for health care. So what's going to drive this change is ultimately employers, employees, then followed by the government, putting in place steps and mechanisms to change lifestyle, which will bring down the cost. Carrots and sticks is the approach right now that is sort of being used as a mechanism. For example, take a health assessment test as an employee. measure your cholesterol, blood pressure, blood sugar levels, etc. Do a measurement, and we'll pay you $50 to $100 for taking that health assessment. Then what that allows the employee to do is motivated to take the health risk assessment. The employer then takes all that data, amasses it, and really develops a benefit plan around where all their costs are. And every company is different. Starbucks, for example, went through this exercise and found out that one of their largest areas of expense for healthcare were orthopedic problems. They didn't know that until they went through this process. Once they discovered that orthopedics were our primary cause for our healthcare insurance increases, they developed an employee benefit plan around orthopedic problems, physical therapy, massage therapy, et cetera, et cetera. So motivating employees to go through this process actually through payments and other bonus type programs is the way to get them engaged. And then long term, you've got to wrap around incentives, carrots, and sticks to keep them engaged.
And what we know is that 70% of all healthcare costs in the United States are incurred by 10% of the population. And these are the ones that have the comorbidities because they're obese, they have diabetes or high blood pressure or heart disease. So if you can cut that by 10%, right? So the 10% of the population has 70% of the cost. You cut that down to 9%, you've saved 7%. So it's all known, it's all knowledge. If there are employers who are saying, okay, you're 50 pounds overweight. We're going to give you a personal trainer. We're going to give you a monthly assessment, and we're going to give you $1,000 a year if you lose that 50 pounds. And if the response is, well, I don't want anybody to tell me what to do, okay, great, you're going to pay $200 more for your health care because that's what the risk says, your call. So it's going to become much more, as Jonathan said, carrot and sticks, based on your health profile. Like at Boeing, for example, we're going to pay people $50 to do an online health assessment to better manage their health care. When that didn't happen, they said, okay, if you don't do that, we're going to charge you $25 a month more for your health care coverage. Your choice. So that's how the companies are going to become self-funding, if you will, and they're going to align initially, at least with insurance companies, to figure that out. In Boeing's case, they drove down healthcare costs by 25% in 3 years.
But for the business people in the room, especially the CEOs, CFOs, and leaders of the organizations, David's absolutely right. And in my earlier point, when I said follow the money, that's critically important. All that said, this is about lifestyle change, making America healthier, empowering people to feel better about themselves through these changes. And for businesses that are moving in this direction, the worst thing you can do is January 1 announce something like, we're implementing this employee wellness program so that we can become 10% more profitable and the shareholders will love us and the CEOs and the corporations are going to get all these big bonuses. And ultimately, it is an economic decision, as I said, and it's an economic issue. But the wonderful thing about the new health age is that we are truly going to become happier, healthier, more balanced people, mind, body, spirit, as the most important benefit of the whole era.
Well, I was about to reflect the fact that I'm still living in the past by saying, so what about the people who aren't insured? But you're going to tell me, under the new system, there's going to be a greater likelihood that more people will be insured. So talk about that.
Well, and that is the crux of the debate. I mean, the crux of the healthcare reform debate today is the 40 million Americans that do not have access to healthcare insurance. And how are we going to pay for that? And what's the appropriate way to pay for that? And what's the reality when you look behind the dollars is that all of us are already paying for the 40 million Americans that don't have insurance. It's simply the dollars are simply being shifted to either the taxpayers or to the employers, because ultimately, for those that work for hospitals in the room, you have to pay your nurses, you have to pay your technicians, you have to keep your light bills on, you've got to buy equipment. There's a cost to providing health care, and right now it's just being shifted. So just to answer that point, in the future, that 40 million, we're just going to pay for that group differently. And David, you want to make a point because it's sort of a longer conversation.
What's the doctor's name in India?
Shetty. Dr. Shetty.
Okay, so there's a Dr. Shetty in India who performs open heart surgeries for $2,000. Okay, in the United States, it's $40,000. He has a higher success rate than the Cleveland Clinic, who charges $40,000. So if you don't have health care in the United States of America, it would be cheaper for you to have open heart surgery, to fly over to India, to have this doctor perform it, and to fly back, and you have a higher chance of living. So there's something out of whack when that is a reality, okay? So we you know, as a futurist, I always like to quote William Gibson, who coined the phrase cyberspace. He said, the future is here, it's just not evenly distributed. So we can say we have the best health care in the world, it's just not evenly distributed. So anybody who has great health care and thinks they have great health care, first of all, how much you're paying for it? And second of all, what about your neighbor who doesn't have it? You know, we talk about, you know, to just be blunt about it, everybody in this country likes to argue and have their point of view because we have no commonality. So we're busy talking about our differences. So we wanted to come up with 10 things, and they're in the book, that we can agree on. Let's start with something we can agree on, like everybody should be healthier and we should bring down healthcare costs. And once you start agreeing on things, then you can find ways to bring about change.
So David, as you travel
Right.
and speak about healthcare, who are the visionaries? Who are the leaders? Who is going to coalesce a whole new vision and get, you know, wrap the public's mind around this?
Jonathan.
David.
Right.
Yeah.
I mean, I don't know. You know, I was just saying when we were talking before that I've spoken in 8 countries this year. And this is the only country I get asked the question, do you think climate change is real? And this is the only country where other countries say, so why don't you guys understand the simple facts about healthcare? So it's kind of like outside our country, it's pretty clear, which is, I come back to my point. We're allowing ourselves to be politicized for politicians' gain, not for our own health and for driving down our healthcare costs.
It's interesting, having taught in a public health program at a different university, we had a number of foreign students, many of whom were getting to know the system here, getting to know people here because they were going to go somewhere else, start a clinic, undercut the costs, and do a good job, and they mostly believe that people will travel. Mm-hmm. And to a large extent, I think people are starting to do that. And so just as we have a global economy for other services and products, we have a global economy for healthcare. So looking at that, it's puzzling to me that the lobbies for big pharma, the American Medical Association, the hospital lobbies are still lobbying for the past.
Well, I mean, follow the money, right?
Yeah.
I mean, how does legislation get made in the United States? Why do we a fossil fuel economy? Why has nobody gone to jail for what happened in the financial collapse? Follow the money. The reason the healthcare bill, I think, was particularly disruptive to us is that the spotlight was shown on how our country writes bills. You know, all the bills are like that. It's not that this is any different. And, you know, we were, you know, so big pharma is arguing for the things of the past. Why? Because you can go to Canada and get the same thing for 1/3 the price. So, you know, from a futures point of view, I say there's no longer any place that is of value. So there's no place monopolies anymore. You know, when I can scan a barcode and find out where I can buy this product in this store for less, there's no place-based monopolies. So in a global economy, there's no place-based monopolies. So those companies that are arguing for taking it back to the way it was want to keep the place-based. We want to charge Americans more because we've been able to do so. I mean, unfortunately, I don't know that to be anything but a true statement.
I want to jump in and answer sort of both questions as well. I think the leader in the new health age will be the free market system, because after doing the research of the book, interviewing countless CEOs of major companies across the country, policymakers, leaders in the healthcare area, the free market sees the economic opportunity to making America healthier. So let's take Medicaid, one of the hardest patient populations to provide care to in America. There are very cutting-edge pilot programs in existence in America today that take the Medicaid population, which are certainly the low-income patient population, and the private sector is willing to take on risk, meaning pay us X amount of dollars per month, per life, to start managing that health care. And by being proactive, by calling patients when they don't refill their prescription for insulin if they're diabetic, literally going into the communities and becoming engaged in grassroots, the private sector is realizing if we take the hardest population in America to treat and take that risk, make them healthier, everybody's going to win. We're going to end up with a healthier population, but yet there's still going to be economic motivations for us to do that. So I truly believe that the free market is what's going to drive this in the 21st century, because we're America, and the free markets and the capitalistic society are what we're ultimately about. People ask all the time, are we predicting a socialized medical system for the 21st century? And the answer is unequivocally no. It would never work in America. That's not who we are as a nation. David and I wrote this book as two very, very proud, patriotic Americans. And we really believe that the values of America, free markets, and our moral values, and our desire to be true Americans are what is going to be the leadership and the drive to get us through this transition and into the new health age.
So let me ask you both, a lot of new kinds of companies are already starting to form to take some management in this new emerging health age. And I was very interested recently to go to a presentation which it was eye-opening to me to discover that now there are companies that have formed simply to do things like tell big insurance plans, look, you know, if a person's willing to drive 2 miles more, they can save 50% on this test. Where I didn't even realize there was that much disparity in cost. To some degree, how do you see entrepreneurial ventures coming into the picture and new kinds of healthcare companies forming?
Well, again, I think what you have to realize is there, outside of healthcare, we expect connectivity. We expect to find information through search. You can't do that in healthcare. Only by the end of this year will 20% of all healthcare records in the United States be electronic or digitized. Now that would be totally unacceptable in banking, totally unacceptable in any business. So the entrepreneurs are going to be those that come in and do what was done with all the other industries. We're going to increase efficiency, increase connectivity, increase transparency, and you know, any doctor who thinks he's a good doctor, or any specialist who thinks she's a good specialist, should embrace that transparency. You know, the thing that gets me is when you think about hospitals. So hospitals are a fairly big institutional part of healthcare. Well, we tend to go to hospitals when we're not well. And so in a transparent future, and if some entrepreneur's going to do this, they're going to get all the hospitals online. You know, you take 34,000 people die every year in our highways. 3 times that number die in our hospitals due to mistakes in hospitals. So it's a more dangerous place to be in a hospital than it is on a highway. Well, what's wrong with that picture? You know, because there isn't any measurement. I mean, what if everybody in this room knew that there were 3 hospitals you could go to, and you could dial up all 3. Oh, this hospital has a 15% infection rate, this one has 5, and this one only has 2. Where would you go? That's how you search for everything else. And so the entrepreneurs who have made that available for our lives with these cool gadgets and this cool connectivity, and the Google guys are going to bring that to healthcare. So anybody who is resisting that, ask them why they are.
You know, an amazing statistic that came out in our research, which is so different than the way we think of other sectors of America. We think sometimes that you have to pay more money to get a better product. Cars, vacation spots, clothing. In healthcare, it can literally be the absolute opposite, that you can get higher outcomes by paying less cost if you're delivering the care in a proactive, preventative way. David and I were speaking to National Device Manufacturing Association in Nashville, and to answer the question about entrepreneurship, there was a startup company that sees the new era of the 21st century medicine that is going to pay for performance, penalize bad outcomes, and think of visits to the emergency room. You go into a little area and there's a curtain that gets wheeled around to give you a little bit of privacy. That's typically a fabric curtain. Where does bacteria like to hang out? In fabric. So this company is literally designing curtains for emergency rooms that function just like the paper towel rack that you see in a lot of public restrooms.
They put it on the ceiling and you just pull it down, and after each procedure you pull it off and another one comes down. Hey, duh.
Yeah.
Now you ask yourself, if you're a hospital, well, why do I want to invest in that? Because the payers, all of us in the room, the employees, the employers, the taxpayers, we can't pay any more for health care. We've got to figure out how to drive this GDP, which is now close to 20% and $8,000 per American, down. We've got to figure out new ways of doing that. One way is saying, okay, hospitals, if you allow patients to come in to the emergency room and they get infections, you're going to make less money. So if the hospitals are now being motivated by that economic driver, then if you're selling this new system that's going to reduce your infection rate, it creates whole new economies and entrepreneur opportunities.
So based on what you know, let's talk about Florida for a minute. Medicare, Medicaid, an aging population, and now you're a legislator. And the session's about to begin, which it will. What would you do if you could do anything in this next legislative session?
Let me answer part of that. Thank you for that question. So I don't think there's anybody in the room that doesn't think we have a fiscal crisis in this country. 40% of Medicare is incurred in the last 30 days of life. We could cut Medicare costs by close to 40% by doing one thing. So if I were to say, what would I do? I would say, hey, United States of America, hey, state of Florida, let's have an intelligent conversation about death. Anybody here not going to die? So we're all going to die, right? So we shouldn't be scared of that. Hopefully all of us think we're going to heaven. It's going to be a nice event, right? So if we were to have, in other words, if you're in your 50s, you probably have one or more parents alive. And if you're in your 50s, you probably have a child coming of age. So you say, son, here's how I want to die. Dad, how do you want to die? 80% of Americans say they want to die at home with their loved ones around them, and that same percent die at $10,000 to $15,000 a day in intensive care. Why? Because, oh, keep him alive, please. And the doctor has sworn an oath to keep the patient alive, so you can memorialize it with the 5 wishes. So I would say, let's have an intelligent. Is anybody from Tidewell here? Tidewell Hospice? Okay, so we've got one of the best hospice organizations in the United States right here. So have them set up a conversation, start leading. How do we have intelligent conversations around death? How do we talk to our children, talk to our parents? How do you want to die? Memorialize that so it trumps should something happen. And we can cut 40% of our healthcare costs just by starting to talk about something that's inevitable. That's what I would do about healthcare, to start help Medicare in the state.
And to that point, please, and to that point, just a month ago, the Pines, many of you know, and some of you were there, held a conference here in this room, and we talked about end of life as part of that. But it's only a beginning, and your point is we need to do it much, much more.
Yeah, I mean, Let's get real about that conversation. If we can get real about that conversation, we can save 40% of Medicare costs. Who doesn't want to save that? And that's not institutional, that's not legislative, that's just shifting a conversation.
And to add to that piece, I'm a healthcare attorney. I've worked with physicians for my nearly 16 years practicing law. I love physicians. The reason I love physicians is because their goal every second of every day is to either make or help their patients get better, cure a disease. Death is a defeat for a physician. So when you get to the end stage of life and you ask a physician, as let's say the child of an ailing parent who's comatose and in ICU, is my parent, going to die? The physician's not God. The physician doesn't necessarily know the timing. And being a Tidewell hospice volunteer, I can tell you that even our patients sometimes will enter into a hospice program because their prognosis is within the last 6 months of life, and they rally because of the good care that they get, and we actually discharge them from hospice. But the point of that conversation is it's a hard conversation. Doctors don't want to, and can't, because they can't predict exactly when mom and dad or brother or sister or child are going to die. So what we've got to do is have more of these intelligent conversations so that we can know at what point do we perhaps move them out of an ICU if that's not where your loved one wanted to be, and maybe put them in a different environment for not only their wishes, but also for the betterment of America. The other two quick things, let's talk about the state side. Medicare is federal, Medicaid is state. So let's talk about Florida Medicaid. As I said earlier, the free markets are going to drive this. And there are pilot programs, and we know of examples in the research of the book, and we have some clients that are engaged in this. You can deliver care to Medicaid population, make them healthier, move them towards a movement towards health, but you've got to give them a lifeline, and there's got to be a transition period. David's example that we talk about in the book is building the interstate highway system. We've got to invest in an interstate highway system in order to travel from Florida to California, and that's not an overnight investment. We can't take Americans on November 29th, 2011 and expect them to change their entire lifestyle in 30, 60, 90 days. It's a process. So from the Medicaid perspective, we've got to be willing, and from Medicare, to invest money into this transitional period towards wellness and prevention and lifestyle change and stress reduction and proactive and efficiency. Invest the money in the interstate system so that we can get the benefits on the backside. So that's a huge issue on the Medicaid side. Quickly then on the private side, small business has got to be addressed in Florida. If you're a big employer in the state of Florida, you can afford to either be self-insured or to jump into larger pools and do a lot of what we're talking about. If you're a small business, 2, 3, 4, even 40 employees, there are no good options in the state of Florida for small business. The legislature, the governor, we've got to address how to bring what we're talking about, how the new health age, to small business in Florida. There are other states that allow associations, American Bar Association for lawyers, American Medical Association, to be a platform for a lot of what we're talking about, but not in the state of Florida. We've got to have some solutions around small business.
Great. If you were to look into your futurist crystal ball, it's funny, I told my grandson I was going to be interviewing a futurist, and he said, well, find out what's going to happen to you. Yeah, but if you were to look ahead, how will our conversation be different, say, in 10 years?
I could spend half an hour on that. Two things. One, there are medical miracles around the corner that are going to transform everybody's life here. I try and stay in great shape. Ray Kurzweil, some of you may have heard the name, he's a futurist. He thinks if he can live to the year 2025, he'll be able to live forever because of the medical miracles around the corner. So there's that much breakthrough about ready to happen. For example, the genetic map, the genetic code, the genome, right? By 2013, it's estimated everybody in this room will be able to spend $1,000 and have your complete genetic mapping done. So let's say you're a 26-year-old woman and you find out you have a genetic disposition to the early onset of Alzheimer's. So what are you going to do at age 26? You're going to spend the rest of your life doing whatever modern medicine says slows down the onset. Take omega-3 fish oil, working out every day, whatever. It becomes preventative. So there's going to be a lot of medical miracles. The other thing, and this is something that, as Jonathan said, we approach this book as being patriotic Americans. We don't have a political point of view. We just think that America needs to embrace this because it's inevitable. So the other thing that I always was getting when I traveled around this country and I was asked the question, are we going to remain a great nation? What I realized, and I started saying, and I started getting spontaneous applause, so then I brought it to Jonathan for the conversation, and we created this, is a vision. When I grew up, anybody who is roughly my age or over the age of 55 in this room grew up with a vision. Whether you were Democrat or Republican, we wanted to put a man on the moon or beat the Russians to get there. That was the vision around which this whole entire country, and anybody who's got any kind of a cool piece of technology in their purse or on their belt here has some genealogically traced back from Kennedy saying we'll get a man on the moon and bring him back. You know, NASA bought all of Intel's chips, so brought down the price, scaled it up. All that stuff happened. So we have something that we're going to start here with the Tampa Bay Partnership in February. It's called the Race to a Healthy America. Simply put, as a country, we want to create a movement. We want to create a vision to make the United States of America the healthiest country in the world by any metrics by the year 2025. And anybody can start doing that right away with basic intelligence. Companies can do that. We've got a lot of resonance around that. It's a simple thing, Race to a Healthy America. So by 2020, my vision would be that we are much healthier. Our costs have gone down dramatically, and our longevity and healthy longevity has dramatically gone up.
I mean, how many of us are tired of seeing economic stimulus basically being we're just going to add to the national debt? The Race to a Healthy America is one of the most opportunistic, great movements for economic stimulus in America that costs basically all of us deciding that we're going to change our lifestyles to an era of health. Walk instead of watch TV. Eat a salad instead of a hamburger. If you're diabetic, stay on your insulin. All of these lifestyle changes that are impacting us by creating all this chronic disease, which, as David said, is costing 70% of the economic resources, can change to stimulate economy, stimulate businesses, make America healthier, happier, and more balanced simply through a movement like the Race to a Healthy America.
That's an exciting concept. I would plug that. I think it's a thrilling idea to think that we would have a vision, because that's always what's missing in a period of change, is somebody to make it clear. There's a simple thing we can do. When we do that, it'll start the whole change process rolling. We have a lot of people here, and I'd like to offer you all an opportunity to ask questions, because I'm sure you have some. I'm sorry to have to tell you that you'll have to come up to the mic to ask a question. So if you want to just sort of line up at the mic, that would be great, and the people that are closest can start. Ask either panelist whatever, and please state your name before you ask the question.
I'm Dr. Mona Jane. I would like to know, I have short answer questions, but 5 of those, and I won't take time. Number 1, would you tell me in future if we will have a continuous quality health care, whether we are talking universal or not? And I'm talking about mental as well as physical health. And physical is your dental, vision, hearing, everything included.
Okay, quick answer.
That's number 1.
Well, we'll answer that one.
Number 2.
The answer, yeah, let's
Okay,
take it one at a time.
I'll just wait.
Yeah. The answer is absolutely yes. For all the reasons that we've talked about, the economic drivers are going to reward quality. So ultimately, behavior responds to incentives. The 21st century new health age is all about incentives to motivate quality. So same thing when you go out and buy a car. Do you want to buy a car that's going to be in the shop once a week or once a month, or would you rather buy a car that's going to be in the shop once every 3 years and the same kind of economic driver? So yes, quality is absolutely a key part.
Question 2.
Number 2, you have practically answered it. We talk about promotion of health, prevention of diseases and disabilities, and early intervention. But see, all I talk about is curative. Like everyone says, if you're sick, then you get cured. What do you think is going to happen?
Well,
Your assumption, I'm more or less talking.
I mean, you know, again, I try to simplify things. I don't think anybody in this room, by the time they were 10, hadn't heard the phrase, an ounce of prevention is worth a pound of cure. And we're living in a society where we pay for the pound of cure. So we wait till we're sick, and then we spend a lot of money to try to get well, whereas it's spending a fraction of that money at the very beginning to stay well, to begin with.
Next is whether it's going to be on computer. Are we going to have a one-stop kind of thing, where I just go to one place on the computer and I get my primary care report, I get my specialist report, I get medical report and everything else?
Yes,
Do you envision that?
Yes, through electronic health record systems, patient portals, patient databases, all of this connectivity is going to bring a lot of that information data to one location that regardless whether you're in California, Maine, Florida, healthcare delivery providers can access that through technology.
And furthermore, everybody in this room is going to own their own medical record, not having to ask somebody's permission to take a look at it. It is yours. It is your health. It is your body. You own it.
Now, people are afraid also that if you don't have a hard copy, if something happens, a virus gets in, or your privacy is not maintained, then what is going to happen?
Well, you know, what's safer, sending something by email to a designated resource or faxing something that sits in a fax machine that 50 people walk by? I mean, hard copy and digital, I don't think there's a, you know, that's a false construct relative to privacy.
Another is women's health is going to be given the same importance as men's health, because women's health has been neglected over the years.
Take that on.
Well, women live longer, you know. There's more people who have prostate cancer than breast cancer, so you know we can have a conversation about that. I'm not sure what the statistics are that you're basing that question on, but I would think that universal health care means universal wellness, regardless of sex.
I mean, if you answer it from a consumer perspective, I mean, data shows that women drive so much of consumer decision making.
Right.
So if you take that to the logical conclusion, absolutely, because part of the new health age is going to be healthcare delivery systems and providers are going to be paid based on patient satisfaction, performance, all of the traditional measures that work in consumerism. So absolutely, I think females.
I purposely asked this question because I'm an educator also, and I'm a physician in preventive medicine also. That we talk about things, but when I did a report, I won't take 1 more minute and I'm done. I always believe that everyone should get a chance. The heart disease is #1 in women. Now we talk about it. We never talked about it in 90s. Lung cancer is more than breast cancer. That's the reason I'm picking up these points. And the next is we live in global world. And you mentioned about you can go to another country, get a better quality health care. So again, the cost factor is very important. How much insurance we are going to pay. A person who is elderly is paying has Medicare A and B, then has a supplementary insurance, and then for medicine, Medicare D, okay? So all these things, main thing is we need to have some sort of control on the cost also.
Agreed. Thank you.
Thank you.
Dr. Charles Benz, and our company delivers wellness and has for many years, and I think you're very hopeful, but there's a little bit of naivete and even a little bit of misinformation. We're not living that much longer than we did 100 years ago. If you take out child deaths, we're living about 4 years longer than we did 100 years ago.
If you take the average lifespan of American born in 1900 was 47 years.
No.
Now it's 50% greater than that.
If you take out child deaths from
Well,
age one,
you can manipulate
Yeah.
statistics as you
No.
want, but at the age of birth,
Just-
we are 50. It's standard. I'm going to push back because all the research we did shows, quote, an approximate 50% increase in the longevity at birth. Yeah, you can take out all the kids who die, okay, and then you can take out all the people. You keep doing that, but at the day of birth, there's been a 50% longevity expectation between 1900 and 2000 in this country.
well, the generation born after the year 2000 will be the first generation in the history of mankind that will not live as long as their parents. So it's not moving in the right direction. This is from the Center for Disease Control. So we're not moving in the right direction. So 50 years ago, 10% of the population was chronically ill. Now, 53% are chronically ill.
Right.
Every child born after the year 2000 has a 45% risk of being diabetic. We're not moving in the right direction.
Can I answer
Sure.
for David Houle, the futurist? I love it when I've heard David speak many, many, many times. One of the best points that he makes when we try to talk about what tomorrow is going to look like, and it goes directly to your question and where your mindset is you have to cut the chains from the past, because so much of our mindset and the way we think about existence and statistics in the world is impacted by exactly what you just did, by data from today and data from the past. What is clear and inevitable when we did the research with St. Louis University, one of the leading institutions for healthcare public policy, healthcare law, et cetera, is that you're absolutely right. Children are unhealthy. You're absolutely right. Middle-aged people are unhealthy. You're absolutely right. The elderly are unhealthy. And we have reached an economic tipping point in America that we can't afford it anymore. Therefore, to answer your question, you've got to cut the chains from all of the data from the past, lift yourself up out of your current thinking, and start reinventing the way you think about how things can happen tomorrow. And why is it going to happen? Because it has to. America is the greatest nation on earth, or one of the greatest nations on earth. We've been through so many challenges as a nation over our history. Civil wars, world wars, terrorism. We get through the hard times by doing exactly what we're doing today, having the hard discussions, having these debates. But the economics and the free markets ultimately are going to drive change because we can't afford it anymore.
You know, your statistics we understand well because we've researched it, and most of that point of view or statements you make are around the incredible increase in obesity in adults and in children. So that's why there needs to be a race to a healthy America and education and wellness. Most of that stuff relative to childhood is based on the fact that it's historically unprecedented levels of childhood obesity.
I agree with you, and I just want to say that this money thing you're talking about is going to be harder than you're suggesting. Pharma and the doctors and the insurance companies are going to fight you and fight us every inch of the way. I went to the Florida legislature and gave them a 10-point program to do all the things
Right.
you're talking about, and guess what? The chairman of the health committee took me aside and said, as long as Blue Cross has the influence over this legislature that they have, these will never happen.
Well, the pushback there is that ultimately, again, follow where the dollars are originating. The dollars are originating from all of us in the room. We're taxpayers, we're employees, we're employers, and we have decided as a state, as a country, as a region, that we can't pay anymore. So the change is already happening. David and I met with a company today that is already looking at ways of changing this model so that they can actually bring people towards wellness, implement prevention of disease, yet also make profits make profits while also lowering healthcare costs. So it is already happening, and there are lots of examples in the book.
But I do want to say, where's the gentleman? I do want to say that we have in a chapter in the book, transitions are difficult. Whenever there's a significant shift, it's a very disruptive transition. So I think costs are going to go up before they go down. I think the heated debate is going to get more heated until it calms down. That's just the nature of historical transitions.
Next question. Hi,
But thank you for going and lobbying for those 10 points.
Indeed. Hi, I'm Susan Borzon. I'm with Ringling College of Art and Design, and if I may date myself, 20 years ago I worked on healthcare reform. Okay, we didn't get anywhere. However, at that point we had, and I'm very excited about your conversation about conductivity, because if I know what the price of something is in one place and it's cheaper somewhere else, I'll go somewhere else.
Right.
But we had a huge discussion about, at the time, 20 years ago, about privacy, and I was told, Susan, let go of it. It's gone. HIPAA was supposed to remedy that. Let's face it, with the Patriot Act, that's gone. We have no privacy. Can we have an intelligent conversation about new policies dealing with privacy in this new world? Thank you.
Let me give the high level and let Jonathan drill down a bit, okay? The high level is the definition of privacy is mutable. It's different 100 years ago than it is today. If you want privacy, you do not use a credit card, you do not use an ATM, you do not use a cell phone, you do not go on the internet. If you do all that and you want privacy, you're living in a context, right? 100 years ago, when the landline was migrating out, reaching market penetration, the two critical pushbacks to getting a landline into your phone was information overload and invasion of privacy. So at any point in time where there is a new technology or a new way or a new order, people think that their privacy is being threatened. I think it's a mutable issue. My point of view is, if I was unconscious anywhere in the world, I would want that paramedic to have full access to my electronic record, more than I'd be interested about keeping me privacy and him injecting me with something which will instantly kill me. So it's a life and death situation relative to that. Do you want to?
Well, as I said earlier, I've been practicing healthcare law for 16 years. I read HIPAA when it was proposed as legislation and read it when it became law, and I've been advising healthcare clients about how to comply with HIPAA ever since it was law. My opinion, certainly not everybody agrees with me, is that health information, protected health information, health privacy is as strong as protected in 2011 as it ever was, if not more so, because as David said, I mean, medical information in paper form to some degree is less secure than it is in an electronic form. Plus, I've represented enough clients over my experience who have made mistakes or errors along the way, and there are penalties for violating these privacy laws. So the healthcare delivery system is very much aware of these penalties, and at least for my clients, I can tell you that they do a very, very good job of securing protected health information and confidential information. So I think David's right. I think it's a fear that in many cases is unfounded based on the real data, because I live in that world.
Just as a follow-up, the concern is, and you can tell I work with too many politicians, is something being used against you, may it be politically or medically, so that I can't get insurance because X, Y, and Z is going to be used against me.
Isn't that pretty interesting that everyone's going to have insurance, so that solves that problem?
Well, and that actually, if you go back, not to get too deep, but if you go back to the core purpose of HIPAA and patient privacy, it was enacted because one of the main reasons was the Human Genome Project, because the policymakers realized that the knowledge base that we were going to gain from mapping the human genome was extremely powerful information. You're born and your DNA is going to tell you at birth whether you're going to have high propensity for breast cancer, heart disease, Alzheimer's. The HIPAA laws were absolutely designed to protect that information. do we live in a perfect world? No, but I really think that this fear around a lot of this is a misnomer.
So just, go back to the medical miracles before the question is, if you think about it, and we all know our genetic code fairly inexpensively in a couple of years, and you were born with a predisposition for fill in the blank, how can anybody say that's a pre-existing condition? I didn't pick my parents. Did you pick yours? Right? So the pre-existing condition occurred at conception in the new genetic world, right? So for anything that's genetic, that's not habitually like smoking cigarettes, if you've got Alzheimer's, if you've got cancer, and that's known at the moment you were born, that's a pre-existing condition. So the genetics changes the game of pre-existing condition because it came from your ancestors.
Next question.
Thank you. My name is Meridian Christie. I'm a healthcare consultant. And I'm going to date myself even a little bit more than Susan did and say that in the 70s I was at the Haight-Ashbury Free Medical Clinic and the Women's Needs Center and healthcare for people, not for profit. In the 70s I started working in health education. And in the 80s I was in graduate school in San Francisco talking about the economics of healthcare. I've been a physician practice administrator ever since. I love and am so inspired by the change of the conversation. But how are we going to get there? And how can, as individuals, as a healthcare consultant, as a physician practice administrator, how can I help and support this activity? Is the Race for a Healthy America based on a grassroots movement? Is it based on education? Are we really going to wait for corporate America to say, we've had enough? What can we do?
Well, let's talk about the Race to a Healthy America for a minute. The Race to the Moon was launched on the east coast of Florida. So when David and I came up with this concept of how do you create a movement in Florida, how do you create a movement in America, we said, David has a condo here, he's featured in residence at Ringling, I have my law practice with Blaylock Walters here, let's launch the Race to a Healthy America on the west coast of Florida. So we reached out to the region's policymakers, and they absolutely loved and embraced the concept of the Race to a Healthy America. So talk about Tampa Bay Partnership for a minute. They, in 2009, 2010, received a large grant from the Robert Wood Johnson Foundation to truly look at healthcare in Tampa Bay. And all of the data and all the statistics are very consistent with the data in our book. 10% of us are costing 70%, and it's all around chronic disease. I mean, there are a few areas that our region was higher in, depression being one, which is ironic, being that we have the sunshine every day, but that's a huge issue. Clinical depression is one of the top 5 chronic diseases that is costing us not only our happiness and our mental health, but it's costing us tremendously on the economic side. So they love the concept. On February 24th, we are going to launch the Race to a Healthy America at the Tampa Bay Convention Center with the Tampa Bay Partnership. What's our call to action? We're going to walk to the moon as a region. 238,000 miles. You take all of the counties across Tampa Bay, it's about 4 million people. That's 17 miles per person. Even if you cut half of the population out, that's 34 miles a person. I run 34 miles in several days, sometimes weeks, so we can do this. It is a movement that is going to take grassroots all across Tampa. There'll be ways that governments, educational institutions, businesses can all log in the miles that they walk, the miles that they run, and as a region, we're going to celebrate walking to the moon. And we're going to set an example for Florida, for the United States, being driven by policymakers, educators, businesses, that we are in a new era because we all want it. And ultimately, we've reached a tipping point economically that we've got to move in that direction. So join the Race to a Healthy America. We will figure out ways of getting it out into the community so that businesses can join on board.
And I think, first of all, I laud your background. I laud you for being a pioneer back then when, you were talking to no one and trying to get everyone to listen. But you know, but that history has a trailing disconnect about corporations finally getting it. I think CFOs get it first now, because you know, as I said, Boeing has a $2.3 billion line item called healthcare. General Electric, $3 billion line item called healthcare. You can lower this? Talk to me, right? So as he said, we've got to the tipping point where it has completely flipped. So the corporations, we think, you know, we've all heard, most of you have heard about ACOs, accountable care organizations. We think it's going to be employer accountable care organizations. So we think employers are really going to move to the front.
The importance of healthcare education and how we're going to get beyond the fact that we've been trying to educate people to smoking or any of the other serious conditions, and we really don't seem to be making a huge lot of headway.
Well,
when you look at all the kids,
it takes a team, right? I mean, ultimately, one of the new structures that we talk about in the new health age is called the medical home. And basically, the concept of a medical home is that the physicians will continue to lead the home. I mean, you've got to become an MD or a DO and go to the residency and get your fellowships to truly understand medicine to the maximum degree. So it will continue to be physician-driven. But we have over 300 million Americans, and we don't have enough doctors to truly educate down to the granular level around the family all of the lifestyle changes that are needed to move into this new era. So absolutely education is going to be a huge part of it. Dietitians, nutritionists, stress management, all of these factors are going to combine together to get information out to the individual to about how they can live a healthier lifestyle. And as David pointed out earlier with connectivity and technology, you know, I'm a proud owner of an iPad, and I am more educated today by just having access to my iPad than I've ever been on topics, because it's accessible, it's easy, and I think more and more of this technology and more of this information is going to be drilled down to your PDAs and your iPads, and really use that technology to get the information out there.
Can we go to the next question, please?
Hello, my name is Verna Safran. I'm an educator and a writer. I have written articles for national magazines about healthcare. My parents moved to Canada when my father retired, and there they got free medical care, very low-cost prescriptions, and they did not have to wait a long time for treatment, as our PR here in America tells us about other countries. Okay, I talked to doctors when I was up there visiting them, and I found it interesting how they made their transition to single-payer care. First of all, it was the doctors who pushed for it because they were sick and tired of all the paperwork involved. They wanted to treat patients. They didn't want to be working for the insurance companies, filling out all these forms. So one province tried it at a time, okay? One province tried it. They found, oh my God, everybody loved it. People were getting a preventive care that they weren't getting before. The doctors were doing their jobs instead of filling out forms. And then it caught on, because you were talking about this transition. I have my main question is, you seem to think the free market is going to take care of everything. Isn't the free market what we have now, how we got into the mess that we're in? And does the free market include big pharma buying off the legislatures? What exactly do you mean by that? And you are linking health care also to employers. We have a growing number of unemployed in this country who will not have access to employer-sponsored health care. We need a whole new system. And I think, don't you think it's kind of hubris and arrogance not to learn from other countries how they are functioning so well in the healthcare industry?
Well, I think ultimately, we've got to look at who we are, not who we are not. And based on the research that we did, It's our belief that America will not adopt a true socialistic, government-sponsored, one-payer system. Regardless whether we like that, don't like that, whatever our political persuasion is, our research shows that that's just not the reality of who we are as a country. All that said, the data is showing, and the pilot programs and the early entrants to the new health age are proving that the free markets and the capitalistic economy that America has can do it as well. Now, does that mean that we don't need the government? Of course not. I mean, everybody needs a safety net at some point in their life. So certainly we don't see government leaving the game of healthcare. But what we see is more private models, frankly, being embraced by the government models versus vice versa being where we're headed in the 21st century.
Yeah, and to your point, you had a obviously specific personal relationship in your conversations with doctors in Canada. As I've traveled the world and spoken, I haven't, you know, whether it's Denmark, New Zealand, Australia, Singapore, South Africa, I haven't been in any country this year where they think they've got their health care right. Nobody thinks they've got perfect health care. That's almost endemic. So to kind of tag on to Jonathan's point, if you accept that we are the greatest or that we're the most entrepreneurial or innovative country in the world, why not let us take a chance at trying to attain perfection rather than pointing and imitating somebody else who doesn't think theirs is really right anyway? I mean, I've talked to CEOs in Canada that don't think their health care is right. You know, so nobody thinks it's right, you know, and so it's time for us to figure ours out. One thing I want to add, because again, I come from a futurist point of view, and some of you may have heard of this recently. I've been talking about for a couple of years that we've entered the era of big data. This plays somewhat to the privacy issue. What big data means is that there's more data coming in to the headquarters in Walmart in 1 hour than came into Walmart headquarters in 1990. So, and this was a vision that a CEO of a Fortune 500 healthcare company said to me, and I've borrowed. He said, in the future, it's not going to be about the doctor and the high cost. So for example, you wake up, anybody wakes up tomorrow morning and you feel really sick and it's not something it's familiar, you got a pain, what do? You call your doctor and you ask her, please, can you get me? Okay, I'll fit you in. So you drag yourself to the doctor, you wait, you know, you go through all those magazines. Finally, you get the 5 minutes with the doctor who does all this and says, we ought to order a bunch of tests. In the era of big data, instead of that, you get up out of bed, you log on to telehealth, like a Skype thing. There'll be a non-doctor, very empathetic healthcare professional who says, okay, so, you know, put this glove on, let me map your vitals. Okay, so tell me what your symptoms are. Okay, hold on just a second. Okay, 145,000 people evidenced those same symptoms in the United States of America last year. 74%, it turned out to be this, and we treated it this way. Are you allergic to? Okay, fine. Then we'll order a prescription, it'll be delivered to your house. Now think how frictionless that was. Think how fast that happened. No doctor was involved. It was just the utilization of data. Now that's what America can do, and I think that's about to happen. That's about 3 years away. But if you start thinking of images like that, all of a sudden it becomes clear what the possibilities are.
I just want to say they try and teach all this education with a lot of machines in the educational system, and then it's not working.
I'm not talking about machines. I'm talking about human beings using data. I'm not talking about machines using data. I didn't say a machine was interacting. I said a human was. Okay.
Next question.
Ken Hughes with Healthcare Realty. You just kind of touched on my question, but where do we envision, or where do you envision the practices that you advise that the future is going to lead for them? If we do move towards a race for a healthier America, how does that affect then the physicians without as many people the goal being not as many people walking through their doors?
We will always need physicians in America. The difference is in the 20th century world, we paid physicians for the most part to treat sickness and to be reactionary in their clinical decisions. How many doctors got paid in the 20th century for making or helping patients get well and preventing disease? So we will always need physicians. What's happening is that the models are just changing. Give you a quick example, which is occurring again today in some of these more progressive healthcare delivery systems. They'll fill a room of this size with patients. Everybody, either the employer or the patient or even Medicare and Medicaid is moving in this direction. Let's say we'll pay $25 per person to come in and listen to this talk. One doctor sits up here and with a dietitian, with a nutritionist, with a stress management person, mental health, behavioral health, and educate all these people about a lot of these changes. Well, do the math. All those providers sitting up here for 1 hour times $25 per person in the room, they can make more money in the model I just described, and it's happening in some of the new models, by doing that for 1 hour, educating a group like this on how to prevent disease and move into wellness, than they can going into an exam room and getting $100 for 15 minutes for treating the flu, that if they had had the flu shot would probably have been a lot less severe to begin with. So absolutely we're going to need physicians. They're going to, again, be the driver and the sort of the nucleus of this medical home. But what physicians are going to be doing is creating a team of all these other delivery providers around them to truly look at the whole person to move in this era of wellness, prevention, and efficiency.
And another way of thinking about it, it's much more of an integrated system where the patient and the primary healthcare provider, the general practitioner, is at the center. Several decades ago, there was a ratio of 5 general practitioners to 1 specialist. Now in America, it's just the inverse. There's 5 specialists to 1 general practitioner.
I guess
so the type of doctor is going to change because of the integration of the system.
Okay.
And let me, not to belabor this point, but this is a critical point to understand. As healthcare delivery systems become more integrated, and you follow that dollar, again, from all of us in the room through insurance and employers and taxes, et cetera, and the dollars get put down to the top of the pyramid, and now the doctors, along with the healthcare delivery system, decides how do we want to apply these dollars. And if you can apply those dollars towards prevention and wellness, I mean, the whole behavior, the whole system, and all of the consequences change, because now in order to make more profit, in order to take home more of those dollars, you don't want to be doing a ton of diagnostic tests and surgeries and only waiting till they come in when they're sick, because your costs are going to go up. You want to prevent disease. You want to make people well so that you increase your profits to then sprinkle across the healthcare delivery system in a different way. We interviewed one national healthcare system for the book, and the medical director for a major healthcare system said, I want to pay doctors more money to stay home. Because when they get to a point where we can prevent the need to go to a doctor, that's the golden goose. The doctors are still making money, and it's over an exaggeration, obviously, but that's part of the new era of where we're headed.
And he also said, speaking of his system, his integrated system, if any one of our patients, any one of our clients, he called them, ends up going to the hospital, we've failed.
And they own hospitals. I mean, this is a true integrated delivery system that is saying we fail as a mindset when our patients are admitted to the hospital. Now, again, that's an over-exaggeration, but it's a totally different way of thinking.
Next question, please. We have time for just the 2 that are standing.
Thank you. Chris Jones. I want David the futurist and Jonathan the lawyer to answer this question. It's a short one. Jack Kevorkian, 2025. Do we put him in jail, or are there 10,000 of them?
I think that the intelligent conversation around death will lead to an acceptance of death. And I think that the legislation dictating how one can die will be fought and successfully won. I don't think anybody in this room wants to have a legislature to dictate how you should leave this life. And I think that that will win the game. So, you know, Kevorkian has a certain amount of historical, contextual baggage, but I think that there will be facilitators where the child, if the parent is unconscious, or the parent who is conscious saying, I want to spend this last day with you, then I want to go. And that will be an accepted practice. That's what I think.
Okay.
Thankfully, I know Chris, so I can be a little bit unique in how I answer this. The problem, Chris, with the way you ask the question is it immediately puts the mindset in a negative place. And I think to truly have the debate that you're asking about, we've got to put our minds in a different place. 80% of Americans, when asked where they want to die at home with their family and their spiritual leader in their midst. 80% of Americans answer that in that way. Yet where do 80% of Americans die? The ICU in a hospital. So we've got to get ourselves out of saying phrases like death squads and Kevorkian and have human, moral, educated discussions about how do we want to die. So do I think that there'll be more Kevorkians, less Kevorkians? It's the wrong question.
Language,
right.
I think we're going to have...
advocate to name there, but...
I think we're going to have, honestly, we're going to have more dialogue about it as a nation. Why? We have no choice. Medicare will be half of the federal budget at the current trajectory by 2020 if we don't change. That's federal Medicare expenditures. David said it, 40% of Medicare is spent in the last 30 days of life. Again, I mentioned I sit on the Tidewell Hospice Board. There are wonderful ways of dealing with end-of-life care that make this a much more educated discussion. And then you will hear this from a healthcare attorney. Part of what needs to occur is tort reform, because part of the concern that so many physicians have in those last 30 days or last hours or minutes of life is that if I make a mistake and encourage something that then fosters death, well, I'm going to get sued, and that's part of the American problem. So tort reform has to be a part of this as well. So it's a very, very complicated discussion, which we do talk about in the book, but I think we've got to get off of the labels and kind of have it in an educated way.
Last question.
Thank you. My name is Bob Goodman. I enjoyed this very much, and I've followed you for a long ways through the new age, but I'm very concerned, and we only spoke very minute, and that was about children and the obesity, and if we want a fit society to compete in a global world, we have to take our head out of the sand and start to do something with building a new health system for our children. What have you done, or have you done anything along that line in building your future?
Well, part of the Race to a Healthy America includes the educational system in America, because one of the answers is it's got to start in our educational system. You know, the definition in some school systems of a healthy meal are tater tots and a hot dog. That's not how we're going to educate our children how to eat right. We're cutting physical education programs so their activity levels are going down. So part of the Race to a Healthy America is rewarding school board members, rewarding superintendents, bonusing principals that can implement policies within our educational system to teach healthy living to our children. Wrap that around the family and the medical home model and bringing those educational tools down to the parents is also a key point. So we do touch on it in the book. You're absolutely right. It's critical. And then on the Medicaid side, for those children who are in the lower socioeconomic class, I have clients, there are pilot projects currently in place in Florida using Medicaid dollars where the systems are going at risk. They're getting, again, flat dollar payments on a monthly basis per child that, again, are in the lower economic socio class. They are making those children healthier, happier, preventing disease, keeping them healthier, again, using this medical home model. So it is part of the future. But you're right, we've got to figure out where to align it and reward it in the educational system.
Well, I want to thank you all very much again. I want to particularly thank our two delightful and thought-provoking panelists, David and Jonathan. And thank you, Linda. And thank you all for coming. And I also want to, again, thank the Blaylock Walters Law Firm for providing a wonderful reception for us. Please go out, enjoy some food and drink, hang around, talk to our panelists, talk to each other, browse the book, buy the book, and have a wonderful evening. Thank you.